Hola, Papa. How are you doing?
Oh, okay, mija. I've just been extra tired lately. Haven't been feeling quite myself.
Are you sick, Papa?
No, I think I'm okay. Maybe I'll try getting out more and getting some more fresh air and exercise.
Okay, Papa. We'll check with the doctor if you start feeling sick. I love you and I will talk to you later.
Adios, mija. Te amo.
Hi, Mr. T. How are you? Mr. T? It's me, Edna, your neighbor.
Please be quiet. I'm trying to listen to the priest's sermon.
Mr. T, are you feeling okay? Do you need some help? Hi, I'd like to call an ambulance for my neighbor. He's a 78-year-old Hispanic man, and he seems quite confused and doesn't know where he is.
No problem. We're on the way. Hi, Mr. T. My name is Alex and I'm here to help. Are you in any pain?
No, no pain.
Okay, I'm going to take you to the hospital to get checked out so we can be sure nothing is wrong, alright?
Gracias, Alex.
Nurse, I have a 78-year-old patient named Mr. T. His neighbor called when she found him on the sidewalk while thinking he was in church. He reports feeling fatigued and nauseous but no vomiting.
Thank you. I'll take it from here. Hi, Mr. T. I'm your nurse Melody, and I'll be helping you out today. Do you know what the date is?
It's Christmas morning.
Mr. T, do you know who I am?
Yes, you're my nurse Melody.
Okay, Mr. T. I'm going to ask you a few questions. I notice you have a history of diabetes and hypertension, and that you take glucophage and Lotensin to manage your medications. Is this correct?
Yes.
Okay, I'm going to run some tests and see what's going on. All right, Mr. T. The results of your test show that you have an abnormal level of white blood cells, a moderate level of blood in your urine, and I hear a bruit, which is a whooshing noise when listening to your left carotid pulse on your neck. I am going to collaborate with my coworkers to create a diagnosis and a care plan to make sure you are back to feeling your best self.
Gracias, nurse Melody.
Nurse Rebecca here. How may I help you?
Rebecca, it's Melody. Did you happen to receive the secure file I sent over on my 78-year-old male? I want to collaborate with you to implement some goals and diagnoses. I came to the conclusion that my patient is experiencing ineffective cerebral tissue perfusion caused by dysfunctional endothelium as evidenced by left carotid pulse bruit 2+ that I discovered. He also experienced accompanying related symptoms of fatigue, nausea, confusion, and signs of hypotension.
Sounds spot on to me, Melody. What are you thinking of doing now? Do you have a short-term or long-term plans to improve your patient's condition?
Well, I was thinking about focusing on improving his cerebral tissue perfusion over the next 12 hours.
Great idea. That should improve his disorientation from a ×1 to a ×2. You can monitor and assess his mental function and speech as indicators of his cerebral circulation and perfusion.
Exactly! I'm also going to keep a close eye on his blood pressure by checking it every hour for the next 12 hours. Making sure his blood pressure is stable is vital in keeping tabs on adequate tissue perfusion. Last, I was thinking of using a vasoconstrictor.
Oh, a vasoconstrictor will reduce vascular resistance and optimize your patient's cardiac output and perfusion. What about long-term goals for your patient?
I am going to provide Mr. T with some information regarding chair yoga. It has been known to improve tissue perfusion by encompassing holistic components to improve health. Also, in order to improve alveolar gas exchange, I was going to place the patient's bed in Fowler's position. And last, I want to take a look at the patient's increasing tolerance to activity.
That's a good idea. That way you know his abilities and what can be done in regards to exercise, which aids in preventing venous stasis and further circulatory compromise.
So, what do you think? Any suggestions?
I think you've laid out some wonderful short-term and long-term goals to promote healing in your patient. Don't forget to be clear with the patient education and with what he needs to do to monitor his health.
Thanks so much. I'm actually going to go speak to him right now. Mr. T, it's Melody, your nurse. How would you like to review some important points to make sure you are aware of the key aspects of maintaining your health?
Sounds great to me.
So, first of all, it's important to remember to take your medication.
Yes, I have a weekly medication holder that I use so that I always remember to take my medications daily.
How would you say your diet has been?
Well, it was great until my wife passed 6 months ago. I haven't been eating a lot, and when I do, it's fast food.
Mr. T, it's very important that you include lots of fruits and vegetables in your diet and select foods that are low in fat and sodium in order to keep your cardiovascular system running smoothly. Here's a pamphlet on great foods to implement into your daily diet.
Yes, I'm very involved in my church, and friends have offered to bring me healthy meals. I should reach out and not be too shy to take advantage of their help.
After having endured tissue perfusion, it's important to take extra care of your cardiovascular system. You can do this by maintaining your weight, limiting your cholesterol intake, and getting exercise.
My new diet will help with that, and I will start walking with my neighbor.
Also, in addition to walking, you may want to look into chair yoga. It may be more accessible and will help with tissue perfusion and staying active. Also, make sure if you start to feel off or tired or nauseous at any point and you are feeling nervous, feel free to reach out to us.
Sounds great. Thank you so much for all of your help.